Hi folks, Michael O'Doherty here, and you are very welcome to the Pendulum Pod, where all health matters worldwide are discussed. Now, joining me this evening is Mary Leahy, all the way from the beautiful Galway city on the west coast of Ireland. And Mary, of course, who is a qualified nurse, a district nurse, or public health nurse, and indeed a midwife. She also recently has been involved heavily on the health and safety side of things in hospitals and dealing with nurses and doctors and so on. And of course, a former vice president, might I add, of the INMO. And of course, it's important at this stage for our listeners to appreciate that Mary is talking to me strictly on a personal capacity, is not reflective of any opinion of the HSE or the government or anybody else. So Mary, all that aside, thank you very much for joining me. Mary, the first question I really want to ask you is, how can we make sense of all of this?
Well, Michael, thank you for having me speak with you, Michael. I guess it's very hard for any of us to make sense of it because we haven't had a crisis in public health for pretty much 100 years. Mm-hmm. So none of your listeners will have experienced anything like this before. Your listeners will have heard a lot of new terminology, coronavirus, COVID-19. This virus, they've also heard it described as a novel virus. So novel, in effect, is another word for new. So it's a new virus for us. It's never been previously seen in humans before. It was identified in Wuhan in China in December 19, thus the number 19 attached to its name. Mm-hmm. And it's from a very large family of viruses called the coronaviruses. And our most recent experience of a coronavirus was the SARS virus in 2002-2003. And SARS is an abbreviated term for severe acute respiratory syndrome. So this COVID-19 effectively is presenting, it's mainly the lung that it's affecting again, and that it's causing acute respiratory syndrome in sufferers.
Yes, and Mary, of course, taking that into consideration, that is presenting huge challenges, obviously, for everybody, but particularly for medical doctors and nurses trying to deal with this.
It is, Michael. The WHO have described it as a pandemic, and a pandemic is something that largely affects a multiple of continents, possibly even the world, which this one is. And I think we're only used in our lifetimes of hearing the word epidemic. Epidemic happens to a widespread area, but it's usually contained. So I don't think we've experienced, most of us would never have recalled experiencing a pandemic before. Mm-hmm. It brings an awful lot of issues to the fore, both on a professional level and on a personal level. We had a lot of challenges in our health system before this in the last decade, as all our listeners will know. Our health services were under severe pressure because of the global economic challenges we suffered. And health, I would safely say, suffered the most out of any area, any public sector area. And on top of that, now to have a pandemic of such magnitude is going to put serious pressure on our health services.
Yeah, and we hear all, I'm thinking of the public here, Mary, that we're hearing all of these new words like, lockdown. We're hearing words like, social sort of disconnect or social sort of space. And, we're hearing words like self-isolation and all of these. And the saddest thing about all this type of vocabulary to people, that it's new, it's different, but it's also frightening.
It's very frightening. And I can understand that fear. And I say as a healthcare professional, we have that fear on a multiple of levels. We have it as on a personal level because we also fear for our own families and for our own health. And we have it, on a collective basis in that on a professional basis rather, in that we're going in to provide healthcare. And that brings, a lot of concern because we've never seen this before. And I suppose particularly with nurses, we've been educated to provide a standard of care, and we're not able to give that standard always. And particularly we fear that as we go forward with this, that it will present challenges to us as professionals, in that, you have a conflict in your mind that you'd like to give a standard of care, but in this situation we're going to have to prioritize, and there's going to be huge pressures on our service, really. So it's going to cause stress to healthcare providers on a multitude of levels.
Yeah, and I suppose that is the big question, isn't it, about how do we deal with this? Because, as you say, it's new, it's a virus.
Yeah,
We have,
yeah,
we don't have our immune system built up, so we
that's
have
right.
huge issues in trying to deal with that. We don't know what the numbers are going to be like, what the
Yeah,
outcome, the aftermath, and all that kind of stuff.
yeah,
So one would certainly, from my perspective, I think that how when we hear those words like social disconnect or a social that distance, that
yeah,
distance away from people and from each
yeah.
other. We're asking people not to connect, not to touch each other, keep away from each other. That has to be difficult, and as well as it being difficult for society, it has also to present issues, obviously, for the spread of the virus and the issues that might arise out of that, the consequences within the hospital environment.
Absolutely.
How
Yeah.
difficult, Mary, is it for people literally to just not to stay 6 feet away from each other?
Well, I suppose the first thing I'd say, I'd have to emphasize how important it is. First of all, coronavirus, we can't see it. It's largely invisible to the naked eye. And my advice to the public would be that to treat people as if they already have it. I think that's the safest approach, because the global population have no immunity. So this will spread like wildfire. It's highly contagious. We know that. And we know that one person who may infect, who may be walking around and not heeding the advice of the HSE or the Department of Health or the WHO, we know that in 5 days' time they will have infected 2.5 people. And we know that 30 days after that one person was maybe heedless or maybe irresponsible, I'll go as far as saying,
Yes.
we know that they will have infected over 400 people. So, some people might think that these actions that we've asked them to abide by, they may think them insignificant, or it's human nature to want to connect with people. They may not heed them all of the time, but I think if they appreciate that one, misdemeanor, we call it, or one casual sort of connect with somebody without thought today, in 30 days' time, they could have infected 400 plus people.
Yeah.
And I think people have to be conscious of the magnitude of that. And I think they also have to consider, I think we have to stay apart to show our concern and our love for other people. That, one of the greatest group of vectors, and by vector I mean people who will transmit this virus. We know that research shows that the greatest group would be between the 20 and 30-year-olds, and very often that group could have a kind of an attitude of, oh, but sure, they don't see illness, they haven't experienced it, they haven't been into hospitals or seen, the challenges that we face. They haven't considered, or they may feel well and think this isn't going to affect me. And unknowns to them, they may never know that they've infected somebody else, because largely that group won't suffer, a great degree of ill health. They may have mild symptoms, and some of them, in fact, may have no symptoms, but still be infective. And, they have to consider that even though they may not know the person that they'd infect, I would go as far as saying that, they will cause death in somebody, be it somebody related, an older person, somebody with an immunocompromised condition, or somebody they may never know, because they'll pass it through other people. So I cannot emphasize the importance of the advice to be given on the HSE website and all the various official sites for advice, the social distancing, the not touching your face, constant hand washing. And the reason why we advocate not to touch your face is we know that it's a droplet infection. So it's transferred through droplets if you sneezed or coughed. And if you touch a surface where the virus has been, or you shake hands with somebody with virus on their hands, or somebody coughs within your distance, it will gain access to the body through your eyes, nose, or mouth, because it's droplet and it's straight into your system then. And that you can be infective a number of days before you have any symptoms. So that goes back to my earlier advice of treat people as if they have it. I think that's the safest way to behave.
Yes, and when you think about the hospitals and how they have to deal with that, there must be, and I've seen it in various other countries and looked at news and various other countries, and the biggest challenge I was seeing that they were having was in actual having equipment. People, we hear these words PPEs, and it's only recently I found out that it's personal protective equipment. You might elaborate on that a little bit, Mary, the difficulties that some health services are having, and as I said, you're only talking from your own personal experience, not from the HSE perspective here, but we're seeing it, right? I mean, I saw it on the American news, I saw it on the English news, the challenge challenges that they're faced with having all of these masks and gloves and suited up and ventilators and all of that. This equipment plays a major role in combating this, or in recovery, I suppose, and combating this illness if people end up in hospitals at the very least.
Oh, absolutely. Michael, it's a global pandemic, and the provision of PPE, as you said, as personal protective equipment, the provision of that, is in great demand at the moment right across the world in varying countries. And what I'd say really is the HSE is, I'd say I'm confident in saying that there are staff working 24/7 to try and get their hands and order PPEs for the employees of the HSE. But, unfortunately, and it's nobody's fault, it's the circumstances we find ourselves in, there's a time delay. You can order something and it mightn't appear, for a number of days. So there's a massive problem on the ground at the moment, because of how highly infectious this particular virus is. It is of vital importance that staff have access to PPE, but it's not, there's a shortage on the ground at the moment. We're doing everything we can, on a personal level behind the scenes. The HSE are doing everything they can to try and mitigate this, but it's proving a great challenge. Now, I'd imagine that's going to be, the pressure there will ease off in the coming days as supplies come in. But, so the first challenge is to acquire the PPE, and the second challenge is then to provide care to people so ill while decked out in this PPE is another challenge, because it involves putting on, visors to prevent any splashes into the eye goggles, masks, and masks of a particular standard. These paper masks, they're not,
yes.
We wouldn't be using those at all. We'd be using what we call respirators that have a filter on the mask that filter the virus particles. And they have to be worn. You have to have full gowns with cuffed sleeves, gloves, over the gowns. And the issues, I suppose the challenges that wearing that type of attire brings is that in any procedure that you're carrying out, you're going to get contaminated, and you have to, the terms we use is don and doff. Don means to put on the equipment, and doff means to take it off. And there's a particular technique that you must use to do that, because you increase risk if you don't adhere to a certain standard of technique. So you could have a nurse in effect in an intensive care unit having to don and doff 4 times on one shift. So there's a high level of PPE needed. The challenges of carrying out care while dressed like that is quite challenging. And, there's issues such as staff fatigue, dehydration, because you can't take a drink like we'd order. In the past, we've taken this for granted. You took a drink of water, whenever you wished at work. You can't do that because you'll contaminate yourself by touching bottles or touching anything else. So staff can become dehydrated, they could become fatigued. And the fear, knowing that you're wearing this attire because you're at risk. So you're permanently aware of your risk all of the time.
Yes.
And of course, as I said earlier, the staff don't have access to the full PPE at the moment, and that brings enhanced fear for staff, and yet you have, we're educated to provide a standard of care, and we went into the area of health because we want to improve people's lives and to help them to heal. And you have that conflict in your mind that you have an instinct to go forward and help, but yet you're aware that it carries huge risk. So there's a lot of issues,
yes,
in that area.
Yeah, absolutely. And, I was thinking during the week there when I was thinking about all of this, and I was just thinking of that, there was a life before Corona virus came along. And I'm just thinking, Mary, of the people, because I know people recently who were due to have surgery for cancer. Yeah. Okay.
Yes. Yeah.
And I just kind of want to put this to you that, when we talked about the social distancing and we talked about the stay at home sort of model that needs to be adapted and all of that, with that in mind, I had this sort of thinking going on, that I'm thinking of the people in the community who have underlying conditions. We call them autoimmune conditions, or we call them immunocompromised people. But these are people who range from a baby right up to the eldest that's alive. Yeah. But the thing I was thinking was, Mary, was that a person is diagnosed with cancer, has had all the treatment, now is due for surgery and has to have it cancelled. I'm just thinking of the consequences of that, and the consequences that if we don't take the advice given by the HSE and the various relevant authorities, that the other people out there who are compromised, who have now had their surgery cancelled because of all of this, or, the child that might be turning up to hospital with an asthma attack, or somebody might go into cardiac arrest, and we need to take all of these other people into consideration. Wouldn't that be fair?
Well, absolutely, Michael. If I go back to my earlier comments that we were already under serious pressure in our health service before ever we knew about COVID-19. And the comment you made there a few moments ago, it presents challenges to the patient or the service user from both points of view. It's not alone that there'll be huge demands on the health service because of COVID-19, but you don't want to bring people into an environment such as a hospital where that there's a high rate of COVID. You don't want to bring in somebody who's immunocompromised or, somebody who's got other risks into an environment like that. So it's not alone the demands on the service, it's that you don't want to expose people to that risk. So really, I suppose this is a public health crisis, and one of the features of a public health crisis is that the health needs overwhelm the available human and material resources. So that's, a very powerful statement to make. I'll say it again, that one of the features of a public health crisis is that human needs overwhelm the available human and material resources. And by human resources, I'm talking about staff, and by the material resources, it's the ability, the capacity, be it availability of medicines, respirators, whatever it is, the physical space to accommodate somebody in a hospital. So, the overwhelming demand of a public health crisis, it sort of justifies, in a way, it brings up ethical issues because it justifies a shift away from a more traditional ethical principle approach to care, in that, before COVID-19, you'd sit down with the patient, you'd involve them in decision making, and the whole aim of care was to the benefit of the patient. But in a public health crisis, you have to have adopted a collective approach that focuses on the good of the community, and with an overarching aim to address morbidity and mortality. And what that effectively means in plain English is you will have to have an ethical dilemma and crisis that when there is a lack of resources, a lack of human resources, or maybe, for example, a lack of a ventilator, the decision is going to have to be made as who gets that ventilator. And that is something that we never thought we'd ever face in our lifetimes.
Yes.
And that has happened in Italy, where, in the past, 2 weeks ago, even 1 week ago, we've heard it's a condition that's affecting older people. In Italy, they're seeing more and more young people affected by this. And there has been cases in Italy where doctors and the extended team have had to look and say, right, we have a 30-year-old or a 32-year-old, who gets the ventilator? And the decision is made based on who's likely to benefit more, who's likely to survive. And that's something we have never been used to in healthcare. So, the vector, we'll say, the 20, 30-year-old out on the street or hanging out with their mates on an evening thinking nothing of this, or the people that are hugging or holding hands, or tonight I'm hearing that the people in Northern Ireland are crossing the border into Donegal and celebrating with groups and partying in caravans, and I'm hearing awful things. This is the reality they need to consider, is that somebody down the line, as a result of their actions, are going to have to look at two sick people and decide who gets the ventilator, who gets the care. And all of the conditions that went on a month ago before we knew about this, and there was a demand, and we had people on trolleys, those people haven't gone away. Those people have chosen not to go into hospital now because of the fear of acquiring COVID. So those people are still existing. Life still goes on. The ordinary things like appendicitis in a teenager, an asthma attack in a child, a diabetic crisis in a middle-aged person, a cardiac event in an older person, a COPD episode in an older person, a frail person who falls and breaks a femur or a hip, all of those things will go on. But, the awfulness that faces us all is COVID-19 is going to take over. And the other thing that we saw on the media today was 25% of all our cases in Ireland are staff or healthcare workers. And when a healthcare worker we know that they've been exposed to this, or they either have it or they're very likely to be at risk of having it, they have to isolate for 14 days. And that brings huge challenges because our available health staff have to literally step away from the healthcare environment in case of infecting patients. So, I cannot emphasize enough the importance of all the measures that we're probably sick of hearing, but we can't be sick of hearing them because they're so important. Yes. To maintain social distance, to stay at home, to only go to the supermarket when you need to go. Don't shake hands. Don't bring people into your home. Like for example, I took my children out of school before the schools closed because I was reading about this and I could see how serious it was emerging. Now, as a conscientious parent, I had taken them out the day before and the schools closed, but nobody has been in my home since. And, I have an instinctive reaction to pick up the phone and invite my friends over for a glass of wine or whatever. I haven't done it. I can't. My children have not brought one friend into the house. And when the schools closed, my daughter was all set for a great time. And I warned her very clearly that not one person would cross our threshold. And that is how serious this is. Nobody will come to the house. My children will not bring anybody home. And in fact, they've gone down to the gate and I've asked them to maintain 3 meters on the inside of the gate and 3 on the outside to have their conversations with their friends. And that's the closest contact they've had with humans since this has happened. And I will do the shopping on my own and I will do it at a quiet time and I will waltz around people in the supermarket to keep away from them. That's how serious this is.
Yeah, I mean, it's
hand washing.
Yeah, it's absolutely frightening, though, Mary. When you just sort of, if people could just play back those couple of minutes again and just listen to what you said, in particular, because I saw it this evening in CNN and in Fox and in the other news. We probably don't get that full image here, but and I heard I think it was the governor of New York, and he was talking about this very situation that you were talking about, this critical care moment that exists, and this decision that may have to be made. And I remember the presenter saying to him, are we at this level yet? Are we at this level where, decisions now are going to be made depending on age and morbidity and all of that kind of thing? And I mean, it was frightening just to contemplate it for a moment, that, that for some stage down the road, that any of us, and I mean, it's not the elderly, like you said, because we are now seeing that initially 30s and 40s are in ICU. But the reality is that any of us, you or I, could absolutely end up in that situation where, that our age, our morbidity, our underlying conditions, or whatever you want to call it, that this could be the difference between life and death. And that's the message that you're giving out to people. And our actions today are going to be determining the life of death of somebody else possibly down the road.
Absolutely. And Michael, you gave the New York context in Italy. We had a consultant on prime time only this week, Dr. Catherine Motherway from Limerick Intensive Care. And she said the exact same thing. It was quite, actually, I would recommend all your listeners to source it on, they'll probably find it on a primetime playback or on Twitter or on the social media platforms, but it's well worth a listen to her because she told it as it is. These are the decisions that will be made in Ireland in possibly about 2 weeks' time.
And Mary, and you were talking earlier on about this social distancing and all of that. But there are other things, of course, that people need to do. And the 2 key other points is that hygiene and the other thing, sanitation, they also play a major role.
Absolutely. The hand washing, I cannot emphasize how important it is. And we have done hand washing training under UV light where, we as healthcare professionals in the past would have thought we were washing our hands well until we did a course on hand hygiene where they put a UV light on the hands to show us after we've washed our hands all the contaminants that remained on the skin. So, there's a technique for washing your hand. And again, I'd recommend your listeners Google that. And you should be washing your hands for, some people have said for the length of a song, some people have said for, at least 20 seconds, but there's a technique, so cannot emphasize the importance of hand washing. When you come out of the supermarket to use, if you can get your hands on the alcohol gel for now, use it before you touch your steering wheel. Clean your phones because your phone is going up to your face at all times. Wipe your phones with alcohol wipes if you can source those. Hand washing, wiping down your surfaces in the home because we now know that the coronavirus, the COVID-19 lives on surfaces. And there's I've heard everything from a number of hours to a number of days. We're still only learning about this virus. There's still evidence changing by the day. And new information coming out, and people may be critical on getting conflicting information. It's because it's emerging. We're learning new things every day. We know it lives on surfaces. It lives on steel, plastic, paper. So again, keep the home. I don't mean to be kind of overly pedantic about it, but keep your home clean, wipe down surfaces, clean your phone, clean your steering wheel of the car. Hand washing, not shaking hands with others, keeping the distance. And I'd say that as well, checking in on this is going to isolate people to a certain extent. But, we've got other ways. We can pick up the phone. We can, call to somebody's house and remain outside the home and ask them, are they okay? Do they need anything? We can drop groceries to somebody's door, leave them on the doorstep, let them know that they're there. There's many ways to show we care about others without having to physically touch. And I think the way we show at the moment how we care about others is remaining distant from each other. We can be very close to each other by remaining physically distant. And I think that's a key message, And another really important message I'd say is that to everybody is what they do today will have a consequence in 2 weeks. So to be mindful at always what they do today will have a serious consequence, and it will either have a negative consequence or a positive. And, sometimes we only see a negative outcome is that I've infected somebody and as a result, X amount are now ill. But we need to look at it differently is, by being careful and by following the advice of the HSE, that there are going to be loads of positive outcomes from what we do, that how many people do we avoid infecting by staying at home, by, keeping the social distance, by hand hygiene, by maintaining all of those advices that we're hearing repeatedly. Look at all of the people we will prevent from getting infected. And that, in effect, is life-saving. That's life-saving behaviour.
Absolutely. And Mary, I suppose the big question on people's minds, and indeed I raised it myself in my own social media platform this week, was are we close? When you present the picture that you've just presented and the implications if we don't adapt to what has been advised by the HSE and the relevant authorities, we see that certainly it's not being taken fully on board by everybody, but in light of that and in light of the consequences of not carrying out that advice, are we now at that point, or do you think that we might be at that point where we could go for an all-out lockdown?
Well, yeah, I suppose I don't want to kind of speak about lockdowns and that you can cause fear, and we have to go by the Department of Public Health. They're checking in with the WHO, they're analysing trends and epidemiology and graphs, and if it needs to be done, they'll call it. So I don't want to sort of advocate anything like that. But there is huge concern, and there is huge concern if the public don't follow the measures. And a few days ago, the predictions were that, we were heading for a peak at the end of this month. And the biggest fear, people have heard flatten the curve. That's another term that's been doing the rounds. And what I'll do my best to describe that really without having visuals. But effectively, if we allow a peak to happen, we're going to have an awful lot of people infected and sick at the one time. And that's going to cause the most awful outcome for humanity, for our citizens, and for our health service, because we're going to have an intense demand on a limited ability to cope. Whereas if we can ease the amount of people who get sick together, it's much more manageable from a health point of view, in that you may have, this may go on for months, and you may have a sustained pressure on the health service, but you won't have, an unmanageable pressure all at once, where we have the scenario we described a moment ago of who gets the ventilator, who gets the care, who do we have to omit care from because we're not able to give care because the demand is such. So if we allow this to peak, it's going to cause devastating consequences. So that's why we're maintaining social isolation, is to try and a virus spreads from person to person. And if person to person isn't in contact with each other, the virus can't spread.
Yes.
So that's why we have to maintain the distance, keep away from people, stay in your homes, get out and walk, get exercise in your gardens, or walk, in country areas and unpopulated parks. There's plenty. I think it was the tourism sector of Ireland have some related information on walks that we were probably never aware of until now. So don't be congregating busy areas where you're going to be stopping and talking to people, because instinctively you'll want to, move closer to somebody to have a decent conversation. Go on your quiet country walks. Go out at times that you believe aren't going to be busy. greet people, don't shake hands, don't stand any closer than 2 meters, don't allow the virus to jump from one to the other. A virus will only spread with human contact. If we keep away from each other, the virus has nowhere to go, and we keep that peak down, and we allow it to be more manageable for us as a nation, for the health services, for everything, and we will reduce mortality.
What you're basically saying is all of this begins within the home, and the thought that comes to mind is in The Art of War, that book I read many times, that the key is to know your enemy, and we know that this enemy needs a host. What you're basically saying in simple terms, Mary, is that we need to starve this enemy of its food. The food is us, we as human beings, and if we don't make ourselves available to it and join it, then we can, as you say, slow it down and limit and minimize the impact that it has within the hospital service, which means that we can ride this out much easier. Other than that,
Absolutely.
basically, you're saying we're talking about huge mortality.
We're talking. I'd go as far as calling it Armageddon. That's what we're talking. It's frightening.
Yes.
And we've never seen it in this country before. And if anybody wants to know the magnitude of what we're facing, just to log on to any social media platform or the internet and look at the army convoy of coffins that was taken from northern Italy down to the south in recent days, because they can't cope with the amount of people that are dying. 700 plus Italians, God rest them, died today. And it's overwhelmed every system in Italy. And they have double the amount of intensive care beds that we have. So we possibly would be far worse than Italy if we allow this to peak. Now, I don't wish to frighten anybody, but I want people to also know the seriousness of this. So I want to try and kind of temper my warnings, and the HSE are trying to access more ventilators. But a ventilator doesn't work on its own, it needs staff.
Yes.
And the more this peaks, the more staff will get infected. So, every single person in this country has a role to play. In the past, some people feel they don't matter, or our political system or our social system hasn't, they haven't made them feel important or made them feel, unnoticed, or whatever whatever social ills we may have complained in the past. Now is a time for me to say to them, every single person matters in this. Every single person who has an action will cause a reaction. And I would ask people to make sure that reaction is a positive reaction, and stay at home, stay away from people. It's the only way we're going to cope.
And as frightening as this may be to any of us, because none of us have any superiority on this, we're all in the same boat here. And as frightening as this is to us, and people who hear this will, think about it as being something that's frightening. Yeah. And as you say, its purpose is really to get us to have a real good look at ourselves and say, look, it could be any of us. But, to kind of, in a way, to kind of finish on a positive note, because that's what we always like to do, Mary. You and I are positive about things. We spell it out for what it is, and you're very experienced in your field. And as I said already, you're not reflecting the opinion of the HSE or any other authority. This is your personal opinion, but you have a huge experience, Mary. But I saw a lovely poem going around the scene. I shared it myself on my own social media, and the line I picked from it was that the sun will shine again. This will pass. And I think that's what we need to focus on, that across the other side of this bridge, that where we are now is this, this time and space where the sun will shine again, where we will hug each other, where we'll be able to sit down and hold each other's hands and join each other in restaurants and in sports events and all of that, and that will be a day of celebration when we'll hear it on the news and see it on the news broadcasted, that the human being has overcome this challenge. Isn't that kind of what we have to, that's the consequences of us making the actual, the differences of that we're going to, taking the heed and just taking those steps to listen to what you're saying, that the sun will shine again and we will overcome it, but that the actions that people take is going to determine when the sun is going to shine. Isn't that the positive side of it?
Already, Michael. I mean, I've seen a huge spiritual consequence to all of this, and that we've had a disconnect with our church for various reasons. We've had a disconnect with, society for various reasons. The collapse of the economy had a huge painful effect on an awful lot of people and awful lot of families who are still suffering arising from that. And And in a way, I've never seen such kindness, and people are connecting with each other. They're finding other ways to connect with each other. People have been forced into slowing down, into stopping very often what was nonsense. Running around like headless chickens, wanting the best of everything, the designer clothes, the labeled items. Success was defined by what you earned and how far you were on various ladders. And this virus doesn't care about whether you have health insurance or whether you don't, or whether you're black, white, yellow or pink. It doesn't care about what type of a house you live, or if you're in Dublin 4 or if you're in the heart of Connemara. It doesn't care. So, we're all the same at the end of the day. And, it has brought out the positive side of humanity. And I'm firmly of the belief, of course, we will smile again and hug again and laugh again. But I think we're going to be a far better race, a far better, I suppose, person and people and collective arising from this, because, even with all of the people losing their jobs, and government now announced today that we're going to look at the €203 per week, that's most likely going to go up. But people are being forced into maybe, even, using up food that might have been wasted before this, being mindful of their shopping, about how they spend money, about, values in life. And it has kind of simplified and pared back all of the, what I'd call nonsense, that we were all running around. We were all stressed and all depleted and all tired and didn't know our neighbours, didn't have time for each other. And I think this is going to change. I'm firmly of the belief that this will bring a positive change for humanity.
Yeah, I was talking to Father Simon Sleeman in Glenstall Abbey recently, and it's something I'll be putting out as well soon. But you were just literally chatting about that this is a time for us to reflect, to reassess, and to resurrect our lives again. Just basically what you have been saying there. There is a great opportunity in all of this, isn't there?
Absolutely. It's incredible. It's almost as if nature has forced a change on us, even to see the dolphins back on the Italian coast, and to see the swans, and all of the nature, how it seems to, the pollution levels apparently have gone down. It's almost like nature had said enough is enough, that we were destroying our planet, really. So
I think it's a very positive way to look at it, to look at it that nature has its own way of balancing things, and not saying that we brought this on ourselves or anything like that, but nature has a great way of balancing, because the reality is, Mary, we really couldn't keep going the way we were going, could we? No,
absolutely. And an awful lot of, I call man-made nonsense, facts, figures, statistics, even in healthcare has got very, very complex and has put a huge burden on nurses trying to deliver care. We're less and less at the bedside and more in paperwork. And at the end of the day, if a patient comes into a hospital ill, they don't care about the paperwork. It doesn't make their situation change. It causes huge stress for nurses. So, maybe this will force us all to take a look at how we've been doing things, and hopefully, streamline and simplify and get rid of a lot of the unnecessary nonsense that was going on in our lives and in our careers and our professions and overall.
Never, I suppose, was it more a truer sentence than our lives and our health are in each other's hands, Mary.
Yeah, absolutely. It has, I think, the levels of stress and cancer in our society was shocking. And I think a lot of it was attributed to stress. So, I think really we've put a huge value on our health now, and a huge value on other people and on community and on communication. And I think we see the importance of each other now, and it will take every one of us to get through this, and every one of us is needed, and every one of us is important, and every one of us has a role to play, and that's community.
Yes, I think absolutely. I think that something only good will come out of this. Mary, I want to really, really thank you for taking the time away. I know you're busy at the moment in relation to your job and all of that, and I really want to thank you very much for taking the time to chat to us. It's been very informative. I think that if people take the advice on board, albeit frightening and all as it may be, I think that if we can take that reality on board, if we can adhere to the advice given by the relevant authorities, you can visit your HSE website and get all of the relevant details there. Tune into the regular media outlets to get the updates and things like that. But the most important thing is that each one of us has a huge role to play. So, Mary, that's the message, isn't it? And I really, really thank you for coming on. Thank you. Really,
it was my pleasure. Thank you, Michael. It was my pleasure. Thank you.
Really appreciate it. Thank you.